Hi, my name is Chris Kemmesat with Mountain View Medicare INsurance. This is part 2 to my Medicare series. We're going to be talking about Original Medicare today. Original Medicare is a federal program, and there are 3 basic parts to it. You have Part A and Part B, and then Part D, which is also mandatory. Part A, an easy way to describe it is hospital inpatient care. And I say anything that happens to you inside a hospital is going to be your Part A. Part B, an easy way to think about it, they say outpatient care. Anything that happens to you outside of a hospital, your regular doctor visits, specialists, things like that are Part B. And Part D is prescription drug coverage. Medicare Part A, hospital inpatient care, there's a $1,556 deductible on Part A, and Part B, there's a $233 deductible. After you've met these deductibles, Medicare pays 80% of all medical expenses, but you're responsible for 20% of all medical expenses. So this Original Medicare, while it's good basic insurance, if you have a bad year, it can get really bad. Under Original Medicare, you can see any doctor in the United States that accepts Original Medicare. Over 90% of doctors in the U.S. take Original Medicare, which gives you a huge market of people that you can see. There's also no networks in Original Medicare, so you don't need permission to see those doctors. If you want to see a specialist, you can make your own decisions and see who you want to see. If you are currently working still and you have group insurance, a lot of people opt to take Part A and not take Part B. Part A, if you've worked 10 years full-time, you're entitled to Part A and there's no cost to it. Part B, there is a premium based off of what your income is. So Part A is hospital inpatient care and you're entitled to it. So a lot of people, even if they're working, choose to take A and will delay taking B until they're ready. Part D is prescription drug coverage. Every company, every insurance company has different drugs that fall into different tiers within their formularies. And a formulary is just that. It is different drugs that they've chosen to fall into different categories. So there's 5 tiers. You have preferred generic drugs, which is that insurance company's preferred generic. Tier 2 is non-preferred generic, which means it's not their one preferred, it'd be their second one. Tier 3 is a specialty drug or a preferred branded drug. Tier 4 is a non-preferred drug, and Tier 5 is a specialty drug. Each tier is going to have a different amount that you're going to pay for that drug. And each insurance company that you pick will have different costs for those. When it comes to costs, I'm going to be careful and talk about some averages and very generic information. Tier 1, typically under $6 to fill a Tier 1 drug. A Tier 2 is typically under $15 Tier 3 is typically under $50. Tier 4s and Tier 5s can get expensive, and it's a set amount of that you'll pay. It is also important to shop around these prescription drug plans, your Ds, with a broker like myself, because different drugs fall in different areas. A specialty drug with one insurance carrier may be a Tier 3 with another. A Tier 1 with one may be a Tier 3 with another. So it's very important to look at your specific drug information that you're taking and comparing those with the different plans in the market. When you turn 65, if you are already drawing Social Security and you do not choose a Part D, the government will put you in a cost saver Part D plan with or without your permission. You can opt out of it, but because it's mandatory, it is going to be put on there. Original Medicare is not necessarily the best option. You have a 20% liability, and if you have a bad year, as I said earlier, it can get very bad. So insurance companies got together and tried to figure out a way to supplement the coverage, the 20% liability. And there are options out there that are better, in my opinion, than Original Medicare. For one, you can supplement the 20% cost, or you can move from Original Medicare to a privatized company like an Advantage or a Part C plan that we're going to talk about next. This is Original Medicare from a top-line perspective. As you can see, it's not necessarily the best insurance available, and if you don't do anything, this is what you're stuck with. Reach out to a broker like myself or someone else, and they can help you get into a better insurance plan that is available to you. I understand Medicare is complicated, and I'm here to help walk you through this process and make it as simple as I possibly can and help you understand it. I do want to tell you again, there's no charge to you to work or hire a broker like me to work for you. I'm looking to build a relationship. This isn't a one-sale business. This is you working with a broker the rest of your life, and that's the relationship that we're trying to build. Feel free to reach out to me. I'd love to set up a meeting, talk to you, and answer any additional questions you may have.